What affects the accuracy of a tuberculin skin test? Imagine trying to catch a whisper in a noisy room. That's similar to what the tuberculin skin test does when it tries to detect tuberculosis infection. Many factors can influence how well this test works, making it either falsely positive or falsely negative. Let's explore what can cause these inaccuracies. A false positive result means the test suggests someone has tuberculosis when they actually do not. This can happen if the person has previously received a vaccine called bacillus, which can cause a reaction similar to TB infection. Also, if someone is infected with other types of mycobacteria that are not tuberculosis, the test might wrongly react to those. Errors during the test process, like incorrect injection or misreading the skin's reaction, can also lead to false positives. Using the wrong antigen during testing can have the same effect. On the flip side, false negative results occur when the test fails to identify an existing TB infection. This can happen if the person's immune system is weakened, a condition known as anergy, which makes it unable to react to the test. People who have been recently infected with TB within the last 8 to 10 weeks might not show a reaction yet because their immune response is still developing. Infants under 6 months old often have immature immune systems that may not respond properly. Recent vaccinations against viruses like measles or varicella, or having a viral illness, can temporarily suppress the immune response, leading to a negative test even if TB is present. Errors in administering or reading the test can also cause false negatives. Severe forms of tuberculosis, such as miliary TB or TB meningitis, along with other serious illnesses like malnutrition or cancer, can also interfere with the test's accuracy. The size of the swelling, called induration, measured in millimeters, helps interpret the results. Different cutoff points are used depending on the person's risk factors. For example, a small swelling of 5 millimeters might be considered positive for people with high risk, like those living with HIV or recent contacts of TB cases. For lower risk groups, a larger induration of 10 or 15 millimeters might be needed to consider the test positive. To improve accuracy, healthcare providers sometimes use two-step testing. This involves giving a second test 1 to 3 weeks after an initial negative result. It helps identify individuals who might have a boosted reaction from past exposure or vaccination, reducing misinterpretation. Timing is also crucial. The test must be read between 48 and 72 hours after administration. Reading it too early or too late can lead to incorrect results, sometimes requiring a retest. In summary, many factors influence the tuberculin skin test's accuracy. Biological factors like immune status, recent infections, or vaccinations play a role, as do technical factors such as proper administration and reading. Understanding these influences helps healthcare providers interpret results correctly and decide on the best follow-up steps. Always remember, if you have concerns about tuberculosis testing, consult a healthcare professional for personalized advice and guidance.